Hello, everyone. Today we're going to be presenting on important milestones for the health education promotion profession from 2000 to the present. One important milestone for health promotion in the United States was dietary guidelines for Americans. It was first released in 1980 and has been updated every 5 years by the USDA and the Health and Human Services Department. The purpose of the dietary guidelines for Americans was to provide advice on what to eat and drink to help Americans meet nutrition needs, promote healthful eating, and prevent chronic diseases caused by poor dietary patterns. Although the Dietary Guidelines for Americans was first released in 1980, we really wanted to focus on the most updated edition of the guidelines, which is for 2020 to 2025. The significance of the 2020-2025 guidelines is that it's one of the first editions to provide guidelines from birth through older adulthood. Every prior edition of the guidelines has focused on Americans aged 2 and older. The other interesting thing about the updated guidelines is that it's organized by life stages. The guidelines start with infants and toddlers and provide guidance on proper dietary patterns for the younger population that guidelines had not included prior to this. The following chapters include children and adolescents, adults, pregnant and lactating women, as well as older adults. Every stage of life has different dietary needs, and having this organizational pattern is helpful for Americans wanting to focus on their age group. The newest guidelines focus on 4 key points. The first point emphasized a healthy dietary pattern at every stage of life and starting these patterns from infancy to instill this value. The second point emphasizes customization and enjoyment of these healthy patterns that reflect personal preferences, cultural traditions, as well as budgetary considerations. We want everyone to eat healthy, but we also need to make sure that foods are personalized to people of different cultures and people of different socioeconomic backgrounds. The third guideline focuses on meeting nutrient needs by implementing more nutrient dense foods while staying within the calorie recommendations for that stage of life. And finally, the guidelines recommended limiting food and drink higher in added sugars, saturated fats, sodium, and limiting alcoholic beverages. The Dietary Guidelines for Americans, specifically the 2020-2025 edition, is an important milestone for health education and promotion because it is what will help form federal nutrition policy and programs to inform the public of recommendations for dietary patterns. It guides national health promotion and disease prevention initiatives by promoting a healthy lifestyle and limiting the risk of preventable diseases related to poor diet. It serves as an information tool for organization and industries. For example, it encourages more nutrition research to be conducted and can be used for food industries to make more healthful products and encourage more helpful labeling for consumers. Additionally, the newest guidelines provide recommendations at such a young age, which had not been targeted in past editions. This will give guidance for all stages of life and establish healthy patterns early in life to make for healthy Americans for years to come. Another historical milestone in the history of health promotion that occurred during the 2000s is the Affordable Care Act, signed into law by the 44th President Barack Obama on March 23rd, 2010. The Affordable Care Act, formerly known as the Patient Protection and Affordable Care Act and nicknamed Obamacare, placed emphasis on prevention and prevention services. This act allowed more Americans access to not only health insurance, but affordable health insurance. When combined with the Healthcare and Education Coalition Act of 2010, it was a representation of the health system's largest expansion of coverage since the passing of Medicaid and Medicare in 1965. This act was created to provide more opportunities for health education specialists to promote health while providing Americans with the necessary amenities to maintain good health. The ACA faced many challenges and criticisms since its awakening in 2010. The fear of raised taxes and loss of current coverage for employees were some of the major concerns of the Affordable Care Act. All aspects of the ACA were placed under scrutiny. The positive effects of the ACA included providing coverage to those with pre-existing conditions, and it also allowed children to stay on their parents' healthcare plans longer. Evidence has shown proof of improvements in access to healthcare, the quality of care, and health outcomes for non-elderly adults. Through the expansion of Medicaid, the ACA has gained and increased in the number of individuals with insurance. Currently, the ACA remains in effect with the Department of Health and Health Services, allowing a 3-month open enrollment period, which gives more Americans the opportunity to sign up for health insurance amid the COVID-19 pandemic. E-health. The 21st century is characterized by technology. The availability of desktop computers and internet allow people access to health information like never before. This phenomenon presented healthcare professionals with an opportunity to educate the public in a new way. eHealth provided a platform for widespread health promotion and introduced a shift from disease treatment to health prevention. eHealth also introduced electronic health records as a way to keep and share patient information easily. mHealth is regarded as medical and public health practice supported by mobile devices. This includes cell phones, apps, wearable devices such as Fitbit or other biosensors, etc. The uses for mHealth range from patient education, data collection and monitoring, to communication and scheduling. mHealth allows the patient 24-hour access to the healthcare system and delivers real-time data to the doctor. This leads to a more personal relationship between doctor and patient, as well as customized treatment options. It has also changed health screenings and scheduling. The ability to check into an appointment from your phone and be pre-screened eliminates wait times, and the appointment between doctor and patient is spent addressing specific concerns the patient has as indicated by the screening. Digital health includes telemedicine, e-health, mHealth, artificial intelligence, virtual reality, augmented reality, 3D printing, robotics, nanotechnology, genome sequencing, and more. Telemedicine is the oldest form of digital health dating back to the 1970s and is still relevant today. Telemedicine allowed the doctor and patient to connect like never before and paved the way for all other forms of digital health. AI is used in large data sets to access and make predictions, which furthers research. Algorithms can be used to predict compliance, create personalized care, suggest a target market for interventions, and more. Virtual reality and augmented reality are often used in rehabilitation. VR is completely digital, while AR influences the user's environment in real time. AR is preferred because it's focused on what is real versus a virtual world. So some considerations to keep in mind that although digital health has revolutionized healthcare in every aspect, health information is more available now than ever, but the regulation of digital health has not caught up to its implementation. Information is now available to every individual, but the correct information can be hard to find. The internet and mobile devices have given everyone a platform to express their opinion and share what they know, and sometimes it's hard to tell the difference between science and pseudoscience. Also, digital health and technology have advanced so quickly that evidence-based standards, policies, and ethical guidelines have not been thoroughly implemented. Though there have been great positive outcomes with digital health, having access to a patient 24 hours comes with the responsibility to protect the patient and their information. One of the biggest concerns with digital health is its privacy. Patients that participate in digital health are constantly adding data to a large data pool, which can be used by third parties, and that brings up the risk of being hacked. The lack of policy in regards to digital health makes this very unclear about how it should be handled. User consent is important going forward, but it's also up to healthcare professionals to help the user understand what it is that they're consenting to. The future of health. Technology is the future of health in every aspect. In our department, a few professors center their research around it. Dr. James has an electronic community health advocacy team, which develops health messages and programs to send out to the public. Dr. Jake Schaffman has multiple published papers on mHealth. Dr. McVeigh focuses on digital health interventions, and Dr. Mobley has a general research interest in eHealth and mHealth. The fact that this program we are in is delivered completely online shows that our professors are invested in digital health and are using this platform to advance the field of health education and behavior. The COVID-19 pandemic has provided a global test of digital healthcare. 2020 began with a global pandemic that forced stay-at-home orders across the world. With this, digital platforms were used to stay in contact and continue life as best as we could. This led to universities and grade schools transitioning to online class, people ordering their groceries from apps, work meetings were now Zoom meetings, and doctor visits were telephone calls. As restrictions are easing up more than a year later, I think the practices held during the pandemic will persist and define this decade.